Are we just causing breast cancer by putting implants in women, especially if they've had a recent diagnosis of breast cancer? This is one of the ideas that I see being discussed all the time on social media. It's usually by accounts who are trying to make women fearful of getting implants or explant experts that want women to remove their implants. But what they never talk about are actual numbers. And a recent study just came out that we should talk about. When people talk about the cancer that is caused from breast implants, they're referring to ALCL, which is a lymphoma, a type of blood cancer that has been associated with breast implants. It's something that plastic surgeons talk to their patients about. But when we talk to our patients, we use actual numbers based on well-done studies. So let's talk about those studies. This first study was a systematic review that looked at all of the other studies that have been done looking at the rate of lymphoma in women with implants, whether or not it was for cosmetic augmentation purposes or for reconstruction. And what they found is that the rate of ALCL in women with textured devices was about 1 in 3,000. The rate in women with all types of implants was about 1 in 14,000. So those are the statistics that I tell my patients. I only use smooth devices, so I use the quote of 1 in 14,000. But there was this recent paper that just came out, and it looked at women who have a diagnosis of BRCA mutation with a history of textured devices. And what they found is that women had about 16 increased risk of developing this lymphoma if they had the textured device with a BRCA mutation. Now, how does this lymphoma typically present? Because I see women in clinic all the time with textured devices freaking out about whether or not they have this lymphoma. The lymphoma typically presents years after the implant was placed, and it often presents with a one-sided breast swelling with a lot of fluid. That's how we diagnose it. We actually sample the fluid and send it for cytology, which is cell analysis. So I do discuss the fact that breast implants do seem to be related to this ALCL cancer, but importantly, I always give patients the statistics, and then they can make an informed decision for themselves in that moment in time as to whether or not they want to have breast reconstruction. Some choose to, some choose not to. Either decision is okay. The most important thing, though, is that they make their decision on good quality data.